All right. Well, Jamie, thank you so much for joining us, taking time out of what I'm sure is a very, very busy schedule between work and your book. First, I wanted to start off with asking what got you into the behavioral health space?
Well, thank you for having me join you this morning. So, I'm a licensed professional counselor by training and spent my first 10 years of my career at Chrysler in Detroit, where I'm from, in human resources. And everyone would always tease me about how I was like always looking for the why behind people's behaviors. And after working there for several years and getting a master's in labor relations, I knew if I ever had the opportunity, I would become a therapist and really dig into why people make the decisions that they do. So when I had the opportunity, I returned to graduate school and then got on the trajectory of addiction treatment really when it was just booming in the early 2000s.
Wow, that's awesome. That's awesome. It sounds like you were a clinician before you were a clinician as well.
I think I was born a clinician, yes.
That's cool. That's cool. I'm sure it made you very, very good at your job as HR. So, next question. You've led organizations through many different moments of major growth and also major transition. What's a leadership decision that you've made that kind of quietly changed things for your team? I find that those quiet decisions are sometimes the most impactful.
Absolutely. And so I would say that there's two answers to that question. The first one is to really honor and dig into the notion of co-occurring disorders. There was a moment in time where we called anything relating to mental health dual diagnosis,
Yeah.
and they would be treated substance use disorder would be treated sequentially with a dual diagnosis. And as the years went on, what we realized is that we needed to treat them simultaneously. And we also needed to address trauma. Trauma, as we know, is the fire in the basement, and someone can have beautiful treatment and do everything right on the SUD side and be working a program. And if they don't address childhood trauma or other trauma, then that's where the cycle of relapse tends to occur because
Yeah.
they can't hang on to it. And so to move programs away from the dual diagnosis sequential treatment more to a co-occurring, what's going on, and looking at someone mind, body, spirit, including family and relationships, has been something that it certainly wasn't my idea, but it's just a movement that I've been honored to be a part of through the decades.
That's awesome. That's awesome. And probably not an easy transition to make organizationally either.
No, it sure isn't.
Yeah. So, as president of Meadows and board chair of the NAATP, what's one industry norm that you think needs to be just rethought or totally thrown out?
Well, as we all work toward expanding access to care, and that's something that we all agree upon. And Meadows, I've been there for a year and a half, pushing 2 years, and we really are expanding our access to care. We've gone in network nationally with Blue Cross Blue Shield and really being able to expand our reach to help more people. As that occurs, and a number of the other players that would be considered not competitors, but our colleagues offering the same types of things, they've had made the same moves as well. With that comes the responsibility, I believe, of cultural humility and being able to ensure that not only our providers mirror our patients so that they can have things to relate to, but that leadership does as well. And I've long been a champion for women in leadership. You know, it's been interesting in the field. We're a field that is staffed by women and run by men. And so, because if you look at the nurses, the clinicians, even the psychiatrists, very, very female. But when you look at the leadership, it's been men. And so that's a norm that I've been pressing on for decades.
Absolutely. Absolutely. That is a very interesting observation. I don't know how I haven't noticed that myself. I think I have heard of it before, but thinking about it, thinking through my clients, it's almost always owned by a man. That's very interesting. Shifting to other topics here briefly, what have you found is one of the hardest things about growing an organization? Because you've expanded and grown many.
Yeah, and so I would say again, there's two things. And you know, the beautiful thing about our industry, it's never just one thing, right? And the ability to hold two things that may be very different simultaneously and work two problems has been something, a skill that I've had to develop. And so I would say that it's the acuity makes it difficult to grow because as we know that patients are more ill than they've ever been and they have more options. So oftentimes, and Meadows, we have all levels of care. But what I've really noticed is by the time someone gets to residential treatment, they're in crisis. They would have been in a higher level of care 5 years ago. So having the staff to safely treat that acuity and to be able to pay them to retain them, that has impacted, I know not just myself, but a number of my colleagues' abilities to grow. And so staffing shortages in therapists, in nurses, in psychiatrists, all of those kinds of things, because as we rise to the level of that acuity, we've got to be able to safely staff. And so I would say patient acuity, ability to safely staff with competent team members, and then also, I mentioned being in network. The payer rates have not risen commensurately with the cost of care. And so those 3 have been a challenge to grow, responsible growth. We can't grow just for the sake of growth.
Absolutely, absolutely. Well, and you can't grow just for the sake of saying that you're expanding care either, right? You have to actually be expanding care to people who need it. So on that topic, what are the best ways that your team finds of gaining new clients and kind of expanding care into the areas that really need you?
So, that's a great question, and I have always been a big, brand ambassador wherever I've been, and we know that people in our industry, people refer to people that they trust, right? And so to ensure that the brand, if you look at the triangle of a culture of safety, where, the brand has to be safe, the employees have to be safe, the patients have to be safe. And so to have a reliable brand where they know that leadership is accessible as well and that the brand is built in such a way that the culture supports it and we know that the teams will keep the promise of that brand. And so there's so many people coming and going in our industry. So to be tried and true through the decades and earn the trust of your referring community, that to me has been the most effective things. Of course, we know SEO and all of those things and now Chat GPT, it all matters. But all roads lead back to trust and having that brand equity and the brand trust and that sense of authority that you really brand authority that you know what you're doing and you've earned your space.
I love that. I love that. I think that's a very, very good point. I think a lot of people get caught up in the tactics, if you will, of SEO, AIO, et cetera, et cetera, et cetera. And they miss the whole point. Once they find you, are they going to trust you and are they going to actually engage?
Right. I mean, I understand the tactics, but I don't think tactically, I think strategically.
Exactly. That's your job as the president, right? Like
Mhm.
that is the whole role, which is good. It's refreshing to hear leaders not get too sucked into the tactics. So on the tactics, what is one of the things in the marketing space right now that is really an interesting tactic or something that you're really watching very carefully?
So something that I've had my eye on for over a year now are directories. And we
Mm,
know that there is a player that is aggregating the directories. They're doing a great job. They're building their brand, they're building the trust, and they have a very strong partnership now with Legit Script, who really has long been our gatekeeper in terms of ethical marketing.
yeah.
So I'm really watching them to see what they're doing and how they're going to do it and how they're going to build that trust. It's a game changer, though.
It is. It definitely can be. And it can be until something breaks that trust, right? Going back to the trust. It is all about the trust. As long as the market trusts the databases, the listing agencies, then it works. And as soon as that trust is broken, it's all out the door. And we've seen that via things like Angie's List and groups like that. Like they were
Yeah.
dominating for a while and then they broke trust and they're gone. And everyone's back to just standard old Google
The other
for
thing
home
I'm
services.
really looking at is no-click admits and ChatGPT and what that's going to change everything as well. And it already has. We've got at least 3 admissions that are no click. They went from ChatGPT to Admit. And, again, how are we building that with brand authority?
Yeah, absolutely. Absolutely. Very cool. Well, thank you so much for joining us, Jamie. I really appreciate the time, the experience, and the work that you and your team are doing.
Thank you.
Absolutely.